Good afternoon, this is Monica. Today I'm going to discuss about this week clinical rotation experience and journal. During this week clinical rotation, I had an opportunity to participate in an ADHD focus clinic, which was particularly meaningful experience for me. I encountered several patients across a different age group presenting with a symptom of inattention, impulsivity, and exclusive executive function difficulties. On the patient interaction that stood out involved a young adult who had been recently diagnosed with ADHD after a year of being mischaracterized as lazy or unmotivated. Observing the diagnostic process, including the use of structured assessment and detailed history taking, deepened my understanding of how ADHD can often overlooked or misunderstood, especially in adults. This experience significantly enhanced my understanding of the PHNP role in identifying and managing the ADHD beyond surface level of symptom. I realized the importance of comprehensive assessment that include development of history, functional impairment, and screening for comorbid conditions such as anxiety or depression. It also reinforced how critical patient education is, as many individuals carry stigma or misconception about ADHD and its untreated. This interaction highlight how the provider not only prescribe medication but also serve as an advocate, educator, supporter in helping the patient reframe their experience. Reflecting on my personal strength, I found that I was able to establish rapport effectively by actively listening and validating the patient's past struggle. My empathetic approach appears to help the patient feel understood and more open during the interaction. However, I also recognize a limitation in my confidence when discussing the pharmacological option, particularly stimulant versus non-stimulant choices. This occasionally made me hesitate in contributing to the discussion. I learned that improving my pharmacological knowledge will strengthen my ability to participate more actively and enhance patient trust in my role as a provider. I thought this experience I gained valuable insight in the therapeutic use of self, particularly the importance of empathy, patience, non-judgmental communication when working with the ADHD patient who may have experienced year of misunderstanding. I learned that validating patient life experience can be just as impactful as initiating medication treatment. Moving forward, I am planning to apply this learning by contributing to build my pharmacological knowledge while maintaining the patient-centered, compassionate approach. I will also be more intentional in using open-ended questions and reflective listening to strengthen the provider patient relationship and improve clinical outcome. This was a great experience and I look forward to implement, as I say, I look forward to implement this experience in my future practice as well. Thank you.